All right, good morning. We're going to get started with the lumbar vertebra. L1 to L5. I'll highlight one here. There's a L3. This is already down. If I go like that.
Oh, okay,
The
okay.
dark will make it not show.
That's gonna make me fall asleep.
It won't show up on the
Okay,
video.
I tried. I'm just trying to recap on the YouTube. Hard to see. Thank you.
Yeah, sorry. There's...
That's all right.
Yeah, if I turn the lights off anymore, you can't see the board.
Yeah, I know. It's okay.
So it's kind of like...
Push through.
So the lumbar vertebrae are the largest of the movable vertebra. And they have these massive bodies. And if you look at them from the side, their spinous processes, they don't point down like the thoracic ones, and they don't, they aren't bifid. So they just kind of look like that. And also if you look at their vertebral foramen, well, you tell me, what shape is it?
Triangle.
It's a triangle, yeah. So they have triangular shaped vertebral foramen. And I don't know, I think the largest clue is their size, but I feel my descriptions, you just have to look at it in lab. And when I ask you to identify which region it's from, it should be fairly obvious if you spend time with the bones in the lab. I think that's the easiest way to identify them. Now, one thing about this region, because it's the lumbar vertebra, this is kind of like you have that curvature of the spine where it's concave posterior. And the way and because these bear the most weight, you have intervertebral discs between all the movable regions, but in this region in particular, they're prone to rupture or herniate. Now, I believe we talked about those discs before, but let's review that. There's a disc right there. If you isolate it, you can kind of see how they're just between the vertebral bodies. That's technically a cartilaginous joint. So what I'm writing is intervertebral discs form cartilaginous joints between vertebral bodies. Now, the cartilaginous joints, a joint is between two bones, but cartilaginous just describes the material that binds the bones together. Let's see if I can cut open a disc here. Let me hide that. I'm going to use the cutting tool on the app. See if I can get this to work. Cut from there to there. No, let's redo that. Let's go many layers. Okay. So when you cut a disc, this kind of looks like when I've seen it on cadavers. It's a pretty good representation. So in the middle of the disc is the Nucleus Pulposus. So I'll just continue the notes for IV discs up here. I've heard this described like a little ball bearing inside the disc where you can kind of squish it and it can squish backwards and forwards and to the left and to the right as you move your chest. Now, the tissue that surrounds it is a fibrocartilage called the annulus fibrosus. We studied that in histology because it's the best example of fibrocartilage I know of. So the annulus fibrosus. And what we said before, it's many layers of fibrocartilage. However, if this tissue weakens over time, the disc is prone to herniate. Imagine every time you bend forward and you squash the disc, you push the nucleus pulposus backwards. And over time, this can herniate, and it can ooze out, and it can compress nerves or even the spinal cord. And well, I erased it, but when this weakens, and then the nucleus pulposus kind of herniates out. It can compress nerves, and that's the problem, causing pain. Maybe it even compresses the spinal cord itself. It's commonly known as a slip disc. I'll put it in quotes because there's nothing that has slipped, it's herniated. So let's put this back together and see if I can show you that. Cords are all tangled. Hold on a second. Oh, where is it? Where's all my, oh, here they are. Lumbar herniated disc.
Nerve roots extend from the spinal cord through the openings of each side of the cervical vertebrae. Intervertebral discs located between the vertebrae prevent friction and allow for smooth movement between vertebrae. A herniated disc may occur due to degeneration of the disc or from rupture of the disc secondary to trauma. The herniated disc compresses the spinal nerve root against the vertebra. This results in pain, numbness, or weakness along the involved arm or hand.
Okay, so that's a good illustration of it. Let's see here. I got a picture of it in the atlas. That's a good reference to look at. Yeah. For those of you who have this atlas, I'm just curious, you don't mind sharing with me. If you bought this atlas, can you raise your hand? Okay, many of you do have it. Page 14 and 15 are good to look at for this stuff. So that's the intervertebral disc. I'm going to move on. I did lumbar vertebra, and I got to do the sacrum coccyx. Okay. I'm going to hide the connective tissues. So I'm highlighting the sacrum. The sacrum is taught as part of the vertebral column, but as you can see, it's also part of the bony pelvis. So the sacrum is 5 fused vertebrae. Most books say fusion will complete by around age 25 or age 18 or something like that. I'll say 25. We still refer to them as S1 to S5 because you can even see the lines of fusion where you would have S1 to S5. Can still see lines of fusion. Let me isolate it and show you what I mean. If this is a bony line of fusion right there, identify vertebra. S2. Yeah, so that makes it possible to identify the S1 to S5 thing. There are other surface features on your study list. I'm just going to go down them. At the top of the list are what are called the auricular surfaces. Let me see if I can highlight them here. Let's do a surface. So you're looking at a lateral view, and what's in green is the auricular surface. Auricular means ear, so it's ear-shaped. It's an ear-shaped surface. when you see it on the bone, you'll see that it's not a smooth surface, it's very rough. And I want you to know it because it basically, this is the surface that articulates with the iliac bone of the hip. Articulates with iliac bone of the hip. And so that joint is called the sacroiliac joint, forming sacroiliac joints. So what I'll do is I'll isolate a hip bone. I haven't taught that yet. And this sacrum here, and you can kind of see what I mean there. So I'll do multi-select. I'll isolate. So let me explode it. So when they come apart like that, you can kind of see how, the back view, how that auricular surface articulates with the hip bone there. Okay, that's important because the vertebral column, the sacrum, has a dual function. It's a part of the vertebral column, but it's binding together your two hip bones, forming a complete bony pelvis for your hips, making it more sturdy than the shoulder, let's say. Okay, well, know the sacroiliac joint, know the auricular surface. The next thing is the superior articular processes.
Is the auricular surface kind of like a facet?
Oh, question is asking if the auricular surface is a facet in the sense that it does articulate with another bone. Usually when the word facet is used to describe a bony surface, it's very smooth.
Oh,
Yeah, in this case, the surface is rough.
okay.
Is that where wedge fractures or hip fractures start?
Typically, a hip fracture is a fracture of the femoral neck, which is right here. But you could fracture here too. Okay, but usually when I hear hip fracture, it's most commonly this right here. Yeah. All right, let's see. Oh, okay. Superior articular processes. So I'm just going to point to them. Because I taught you this surface feature before. The superior articular processes are these parts sticking up here. Okay? And, well, which vertebra is this on top? This is the top of the, yeah, S1. So what does it articulate? It will articulate with L5 on top of that. So it goes L5, S1. So you have superior articular processes, but you don't have inferior ones because well, they're all fused together. Okay, so that's what I want you to see. Superior articular processes. Superior articular processes of S1. Another thing of S1 that's kind of used as a landmark is the Sacral Promontory. Go to landmarks. No, not that one. This one. So it's highlighted in green. That front edge of S1, that's called the Sacral Promontory. It's a landmark for obstetricians. Sacral Promontory, again of S1. An anatomical landmark. You can palpate it. Let me kind of show you again. Let me get the hip bone back in there. So I'm going to put this back together. I'm going to like do multi-select. So when we look at it from the side, you can see that the sacral promontory is right here. There's a distance from here to the front of the pubis. Now this distance, I think it's something like 17 centimeters. Well, anyways, obstetricians, they can palpate this, like with their fingers like that. They can try to examine the width here when you're giving birth. So I haven't done this myself, but that is used as a landmark for, and that distance is measured. So that's why we teach in anatomy, the sacral promontory. You should know that. It's basically just the front edge of S1, right? The anterior top edge of S1. So I have anterior and posterior sacral foramina. Well, that's an easy one to teach. It's easy to see. Do you see the 4 paired holes? Yeah, if you see it, this is, well, let me ask you, do you think this is the anterior view or the posterior view? This is the anterior view, so we just call them anterior sacral foramina. And if you see it from the posterior view, just call them posterior sacral foramina. So I'll just list it as anterior and posterior sacral foramina. Earlier I mentioned the lines of fusion. On your study list, I'm seeing them listed as transverse lines. So, but it's the same thing as those lines of fusion. Call them either one. Well, I see 4 of them, so I can point to any of them. 1, 2, 3, 4 lines of fusion. And notice that the shape is kind of triangular, and that this superior part here are called the wing of the sacrum, or this one here. Wing of sacrum. If you see it labeled ala, A-L-A, that means wing in anatomy. So you can call it wing of sacrum or ala, but because there's 2 wings, if you put an E, that pluralizes it. Okay, so that's the term. And because these are fused together, posteriorly, instead of individual spinous processes, they're kind of fused together. And let me see if I can get that highlighted here for you. Yeah, what's highlighted in green are what I would refer to as the median sacral crest. second sacral crest represents all the spinous processes fused together. Fused spinous processes. There's one lateral sacral crest, and then on the other side, lateral sacral crest on the right side. Those crests highlighted in green is basically, well, they're kind of like this, except they would be the fused transverse processes. Lateral sacral crest represents fused transverse processes. Last on the study list are the sacral canal and hiatus. So let me go back over here. I saw them there. It's highlighted in a very faint purple, that triangle. It's like an upside down Hershey kiss shape. It's right there. That's a canal. Okay. It's a continuation of the vertebral canal, going all the way down to the sacrum. Describe this shape. It's triangular. You remember the shape of the vertebral foramen in the lumbar region? Also triangular, so it kind of just fits the shape. Sacral canal. Basically, that's going to be a passageway for spinal nerves will be contained within that canal. Not the spinal cord. Contains spinal nerves. The spinal cord ends at about the level of L1, L2. So the vertebral canal is longer than the spinal cord. Let's see here. See if I do a hide others. Let me turn on the central nervous system there. Where is that? Oh, it doesn't let me do it. There we go. Wait, that's what I mean. See those yellow structures entering the sacral canal? That's not the spinal cord. That's actually spinal nerves. And they're in the shape of a horsetail, kind of. And they call it cauda equina. Cauda equina. Because that means horse tail, equine, and cauda means tail. So they go into the sacral canal. Then you have the sacral hiatus. Let me turn this off. Oops. Let's go home. Show hidden. There's the sacral hiatus, again in that faint purple. It's a space. So the canal and the hiatus are spaces, really, and it's this space right in there. It's pretty much the end, right? The end of the vertebral canal. space ends the vertebral canal. Well, really, the end is really the tailbone, the coccyx. Tailbone. In terms of anatomy, I just call it the coccyx. I don't really teach any surface features. You can crack it and fracture it. Other than that, just know it's there. And that completes the lecture of vertebral column. I want to take a break. The lecture was a little shorter today. But I want to describe the, well, for the lab quiz on Wednesday, I want to change the format a little bit. You write this on the board so it's clear. I did mention an announcement. Some were asking, what's the quiz format going to be? It's in the PowerPoint, but what am I going to use? I said I'd use those slides. Did anyone see that?
Yeah.
Okay. What I like about those slides, they have pictures from the book, but didn't have real pictures of vertebrae in our lab. I mean, I like that it does that because I want you to study our bones in the lab, so know them. And so the lab quiz on Wednesday. Instead of having it at the beginning of lab, I want to have it right at the beginning of class at 7:30. That's the main thing I want to do. And I've always thought that we're too crowded in here for quizzes. There's too many bodies in the room for a quiz. So I want to break you up into two groups. Let's call it Group A, Group B. That'll space you out enough to my liking for proctoring purposes. I'll put you in groups, I don't know, kind of randomly. And what I'll do is, to make it easy, I'll post it on Canvas today, and you check to see what group you're in. Group A will go first. Maybe I'll switch it up, but A first, B second. I'm not sure how many questions I want to ask you. I usually ask 12, but since I'm doing it twice, and I want to save some time, I'll shorten it up. Maybe something like 8 to 10 fill-in. So the fill-in part is the important part for a lab quiz. I want you to be able to spell these things absolutely, utterly correct. Sometimes I'm lenient. If it's a letter off, maybe I'll let it go. But yeah, it's starting off, I'm more strict. I want you to get it. I want you to nail it. Okay? Spelling is the most fundamental evidence that you know something, right? Like, say for example, I ask you what your name is. Could you tell me? Of course you could tell me. What if I asked you to spell your name? Could you spell it? Of course you could spell your name. So that's great. You know your name and you can spell it. That tells me you know your name. So students always tell me, well, do I have to spell it? It's like, yeah, you have to spell it. That means you know it. So that's kind of my thinking. It's like, if you spell it, you know. If you can't even spell it, I don't think you know it. So I really emphasize spelling in my class. Okay, not all instructors do, but I'm not going to give you a pass on spelling. 8 to 10 fill-in. I'm going to put you in groups. So maybe it'll take me 10 minutes to administer. So if you're in Group B, maybe if you're a couple minutes late, maybe that's okay. But I suggest you all get here at 7:30. I'm going to open the door. I'm going to say, Group A, come on in. And then I'm going to lock the door during the quiz. So that way there's no interruptions. Okay? I don't like locked doors and barriers and things like that, but just for administering a quiz, it prevents interruptions. If you're locked out, tough. Get here on time. That way you won't miss the quiz. I know points are important to you, and I get a lot of complaints if you miss a quiz, your car broke down, and I can work with you if something weird happened. But I'm locking the door. Is that understood? 2 groups, lock the door, boom, spelling counts. Any questions?
Is it just over what we went over already?
Yeah, basically the lab quiz covers what's on the lab study guide, so the first page. Any other questions? All right, let's take a break. When we come back, I'll have the bones out. The rest of the time, you can just study the bones.